What does this look like for the future moving forward?
Well, great question. There's a new rule that was introduced in the final rule for 2024, which changes it as of the 2025 performance year. So, starting with the 2025 performance year, everyone in an APM, whether a MIPS APM or advanced APM, needs to use certified electronic health record technology, that is CERT. And everyone, whether a MIPS or advanced APM, needs to submit a MIPS PI, make a MIPS PI submission. Now, both of those share the MIPS exceptions to PI. So the usual exceptions apply to both using CERT for an APM and submitting PI from within that APM. These exceptions apply at the individual or group level, except for the small practice designation, which if all the practices in an APM entity are small practices, the APM entity gets that small practice designation. But that's the only exception that applies to the APM level, and APMs are not allowed to apply for specialty hardship exceptions. But the individuals and groups participating in the APM can apply for exceptions and be individually or at the group level accepted from the need to use CERT or to submit a MIPS PI submission.
So in 2025, or in program year 25, when we're reporting for 2025 data, every provider, every NPI will need to use CERT and need to submit PI unless they have some other exemption. Is that right?
That's correct. So Medicare will, as part of their evaluation of the annual scoring and performance, they'll be looking for a matchup between the participants in the APM, and participants are followed quarterly and then snapshotted quarterly. They're going to be looking for a matchup between those and an applicable PI submission. And that, I think, is likely to be their primary means of checking for compliance with a 100% use requirement. Although they also have the option, because the contract exists, they'll have the option to audit the participating providers to make sure everyone's, as they said, as they're claiming, using CERT.